Hi, my name is Nakrisha. I'm a nursing student from Kaiser University, and I am here to perform suctioning of your NG tube. I'm going to perform hand hygiene, washing my hands at the sink. And could you please give me your name and date of birth? Okay, I'm going to make sure the patient's name and date of birth matches the chart. I can also take a look at the patient's name band on their arm. Mrs. Jones, do you have any allergies to medications? Any allergies at all that I need to know about? No? Okay, perfect. I'm going to provide patient privacy, and I'm going to lift the patient's bed up to working height. I'm going to make sure the side rails remain up on the side that I'm not working on. Okay, and then okay, so Mrs. Jones, the doctor wants me to make sure I keep your trach suction. Whenever I hear that you have some difficulty breathing, or if I hear that you have some congestion going on, I'm going to go ahead and perform that suctioning. If you have any questions, please let me know. I'm going to check the patient's oxygen saturation. Right now, the oxygen is 88%. Also, I'm going to auscultate the lungs. And I can also do that on the patient's back. Okay, so I've auscultated the lungs, and I hear bronchi in all 4 fields. Okay, so with that being said, I'm going to go ahead and perform the suctioning for the trach tube. I'm going to place my chuck over the patient. I have my suction kit. I'm going to place it on the bedside of the patient, and when I open it, I'm going to make sure that I open it away from me. And I'm going to make sure that my sterile fill would normally remain at above my waist, but I'm just going to place it there. But I do realize that it needs to be up here closer to me. Okay, so I'm going to open that up again away from me. There is a sterile basin inside of the trach kit. I'm going to get that out from this side without reaching over directly into my sterile field. And I'm going to just bring that over here. I'm making sure that I don't touch the inside of the actual trach kit to prevent break-in sterility. Okay, so I'm going to pour my normal saline into my basin that I got out of my trach kit. I'm going to take these off. And I'm going to put on the proper PPE. So I'm going to put on my gown. And my mask. and my goggles, which I don't have, but I have on glasses, even though glasses are not usually used. I can make my glasses my goggles just for visualization purposes. Now they're getting fogged up. Okay, and then I am going to reach in to my kit, and I'm going to again make sure I'm not breaking sterility, but just grab my gloves that's sterile. I'm going to open them up. This will be done on the bedside and not on top of the patient. I'm going to open and put on my sterile gloves. Let me do that down here actually. Now that I have sterile, I need to make sure that I don't put my hands below my field or below my waist. I need to stay up here, and I need to be conscious of what I am touching. Okay, so now I'm going to, now that I have my gloves on, I'm going to connect the sterile suction catheter to the suctioning tube that's inside of my trach suctioning kit. So this was inside of my kit, and this is at the patient's bedside, but I'm not going to touch it yet. I'm just going to, because my hands are sterile, I'm going to ball it up, make sure I have a good grasp on it.